Welcome back to American Medicine Today. I'm Kimberly Bonati, and I'd like to welcome to the program from Bridgeport, West Virginia, Deborah Vaughn. Thank you for joining us, Deborah.
Thank you for having me.
So, Deborah, why don't you tell us what started your pain?
I believe it was just degeneration over time.
Can you tell us what type of pain you were having and for how long?
Well, for about the last 10 years, I've been having just like minor back pain. And then it's just kind of been getting, a little bit worse.
So let me backtrack you for a minute. Now, when you were talking about severe pain, apparently it was radiating, right?
About 2 years ago, I started having severe leg pain to the point to where it felt like my leg was not even connecting properly, and I was having to drag my left leg. And I was up like every night, all night with pain, just constantly, and going to the doctor and being misdiagnosed, and everybody just wanted to give me pain medications.
Because it was in your hips and then down to your leg into the knee, was it also affecting your foot?
Yeah. Yes.
Okay, and then you talk about trying all different things and people misdiagnosing you. Can you just tell anyone that's watching what type of conservative treatments that you underwent?
Yes. First, they put me on muscle relaxers, and then they put me on pain medications. I went for injections in my back. They put me on gabapentin. They sent me to physical therapy, and nothing seemed to work. It just seemed to get worse.
Right, because when you're on medications, you compound problems and you're just really masking the pain. But tell me, did any other doctors say that they could help you or?
No, I had two different surgeons that I went to told me that they did not want to operate on me, that they just wanted me to just keep getting the injections. The one told me that when it got so severe that I couldn't stand it anymore, that they would operate and put in pins and all that kind of stuff. And that was just not the route I wanted to go.
Well, you're very lucky you said no, because 1-level fusions fail 65% of the time and 2 to 3-level fusions fail 85% of the time. And what's really weird is that your doctor said they could do nothing to really help you, except have you say yes to invasive hardware fusion surgeries. Well, thank goodness you didn't go that path. Now, why don't you tell us about the path you chose to take?
Was about to lose hope that anything could be done. And I was watching Newsmax and I saw a commercial and it was Dr. Bonati, and they were talking about how they could do the surgery without using all the hardware, and that there was new technology. And so I thought, what have I got to lose? I'm just going to give them a call and see if they can help me. So I did. I called and I told them what was going on, and sent my records and everything in, and Dr. Bonati called me back and he said, I can help you. Come on down.
What was it like to finally be told by a doctor that something could be done?
Well, I felt like I was getting my life back.
So why don't you tell us what it was like hearing over the phone that you could get your life back, and then you travel all the way from West Virginia to Hudson, Florida, just north of the Tampa Bay area, and now you're face to face with the surgeon in the evaluation room that's telling you that same thing. And then, can you kind of walk us through the surgery?
Well, from the minute that we got there, we were greeted and just treated like they really cared about us. And they just took me to all the different places I needed to go to and got in with the surgeon. And he had looked over everything and taken the time, that was needed. And he sat us down and he said, this is exactly what's going on. He showed us, the pictures and told us the procedures and everything that needed to be done, and scheduled it for 2 days later. And so I came in for the day of surgery, and they explained everything to me that was going to happen. So I was very aware of, what was going to be happening. And that relieved a lot of the fear. And then I, got on the table and everything, and they started. And honestly, it was just a great experience for me. And I'm just so thankful for Dr. Bonati and for the clinic. And I just, I'm so thankful to have my life back.
Aw. Well, you're a gleaming example of why Dr. Bonati got out of traditional spine surgery and created his own exclusive patented Bonati spine procedures, which was, to put the patient in the forefront of his mind and to relieve the pain. Now, they utilize something called conscious IV sedation, where the patient is sedated, but they're awake and able to communicate, and they are given the opportunity to watch. Now, some people remember everything, and some people remember bits and pieces, but what was that experience like for you?
I remember the beginning. They told me, if I feel pain in my back, say back, and if I feel pain in my leg, say leg. And so I remember doing that a few times.
Now, why don't you tell me, when did you notice a relief of the pain that brought you into the Bonati Spine Institute? And they bring you straight to recovery, so tell us what those first steps were like. And when did you notice you were better?
The first steps, of course, I was still very sore and everything, so I could not tell a difference until later that evening when I was in the hotel. And after I had gotten up and was walking around some, it was like the leg pain is not there. Mm-hmm. It's gone already. And from that point on, I've not had it ever again.
And you say leg pain, but were you dragging your foot?
It was gone. I mean, from the time that I left, it was gone.
So from Bonati to the hotel, your pain was gone and there was no more dragging your foot. So when you were released, did they have you wearing any sort of back brace?
No, I did not.
Well, all right. That's because we tell people to just be up and walking, to ambulate, because that helps the body heal and there's no need for any types of devices. So thank you so much for sharing your story of recovery with us, Deborah. And we're so happy to hear that you've regained your strength and gotten back in motion.
Well, thank you so much. And thank you, Dr. Bonati.
And I also hear that congratulations are in order because you're a new grandma.
Thank you.
If you would like to hear more stories just like Deborah's, go to YouTube and visit the Bonati Spine Institute. And if you'd like to find out if you're a candidate for the Bonati Spine procedures, visit askbonati.com.